If you suffer from low back pain or sciatica, stick around because it's time to do another video on the Curtis technique. Periodically I like to do that because the technique is so effective, and in some cases it's absolutely miraculous what it can do. And since I first introduced that technique in TikTok videos and on my newsletter, longlifehealthy.life, I've had millions of views. I've had videos that have gone viral. I've had tens of thousands of comments. I think we're pushing 100,000 comments just on that technique alone. Most of the comments are people saying, I tried it and it worked. Thank you. This technique is not for sale. It's a free gift. All you have to do is watch this video. I'm going to teach you how to do it on yourself or do it on another person. Some people don't believe in it because they can't see how there could be a connection between the area right here and the low back or the sciatic nerve. That's because they don't understand the human body. I've had a couple of cases where people made comments and said they asked their doctor about it and the doctor said there could possibly be a connection. That kind of closed-mindedness is what's held the human race back in so many ways throughout human history. What those people are saying is, if I don't understand it, it doesn't work. If I don't know about it, it doesn't exist. If you want to understand this technique, I believe you've got to understand fascia. And very few doctors of any discipline understand fascia, and they need to. We all need to learn more about this subject. But anyway, here's the Curtis technique. You find the center of the armpit. Then you go down about a hand's width, roughly, and start pressing really hard. You're not rubbing, you're pressing deeply. Search around until you find a really sore spot. If you have low back pain or sciatica, that spot's going to be there. When you find that spot, then you're going to dig in. Now, you're not massaging like this, you're digging in deeply. You're going to hate me for about 30 seconds because it's going to hurt. You've got to make it hurt. That's the only disadvantage of this technique. It's painful. On the other hand, if the painful spot wasn't there, we wouldn't know where to press. So press on that spot for about 30 seconds. Do both sides. I would focus primarily on the side of the pain, but do both sides. Now, up a little higher, there's a point that often works for the neck, but I've primarily used this technique for low back issues and neurological issues radiating from the lumbar spine. Now, if you do it on another person, have them lie on their side. It makes it easier. And then raise the arm, and then you can get in there and work on it. You can use the fingers of both hands. You can use your thumbs or the fingers of one hand. The point is to dig in there and make it hurt. Please help me spread the word about this technique. Trust me, it works. I've used it for decades. And now, since I've been doing videos and articles about it, millions more people know about it. So help spread the word. And if you are a health provider, this is an amazing tool that will enable you to help people that you couldn't help previously. I estimate it works about 90% of the time. I hope you'll try it, and I hope you'll tell others about it.